What does ECMO stand for, first and foremost?
Extracorporeal Membraneous Oxygenation.
Yeah, extracorporeal membranous oxygenation. So basically, we're taking control, and in COVID times, this was talked about a lot because ECMO is the end of the line. We can do, so let's talk about first, what are our like rescue maneuvers if we're on the ventilator and we're maxed out? We are 100% FiO2. Here, we're very aggressive with peeping up patients because we're trauma surgeons and that doesn't scare us. We'd rather save the patient than them have high peak pressures. So we'll peep them up real high. What are things then we do as like rescue maneuvers before we get to ECMO? Because ECMO's that's it. There's nothing else I can do before that. What else can I do before ECMO? So in babies, we do what's called high-frequency oscillatory ventilation. My son was on that, actually, when he was born, because he had severe ARDS because he was born at 26 weeks. So that's typically in the neonatal population. There's another interesting vent setting called APRV. Anybody ever heard of that? Probably not. We don't do it here too often. Airway pressure release ventilation, where you set a P low, P high, T low, T high. And basically it's like this. You're like holding the alveoli open at a high pressure for an extended period of time. Airway pressure release ventilation. Problem with that, they get super hypercapnic because you're not like, you're like holding the, you're like, it's almost like you're holding your breath kind of a thing. So again, that's a method. What do we do here, though, a lot when we have bad ARDS? Yeah. Yeah, we prone them. Okay? So proning works really well. So you're flirting with high FiO2s, high peeps. They don't look like they're getting better. You got to get the prone bed because it's not like always just right there. So it has to come to us. So that's something to always think about. Okay? So then, all right, we're like, nothing's working, okay? We need to do ECMO, okay? The question is, there's two different types of ECMO. Familiar? Or? Here we go, yeah. So VA and VV ECMO. Okay, very simple for the two to break this down. VA ECMO, the pump's broken too. So VA ECMO is like bypass, really. So you're having, the machine is pumping and oxygenating and ventilating, okay? Versus VV, the pump is okay, but the lungs are broken. So VV ECMO is like your COVID patient or your ARDS patient. The pump works, the heart's okay, but the lungs are shot for whatever reason. Our trauma patients, what's the reason maybe like our trauma patients go into bad ARDS? Yeah, that's actually, yes, it's very good. So someone gets an MTP. What's the thing here that people weren't understanding? Yes, so you can get an abdominal compartment syndrome, okay? Or you can get what you just described, a horrible ARDS from massive transfusion. And there's a different thing called what for based on transfusion? Trolley, transfusion-related acute lung injury. We could talk about the Berlin criteria, because we used to call things acute lung injury, but now we really just use the Berlin classification for ARDS. Did we talk about that yet? Nobody? No, we would talk about that. So VA, pump's broken. VV, and that's where the cannulas are. So there's a venous and an arterial, or there's just venous, okay? So then what happens? Well, you take the blood out. It's like dialysis, but for the lungs. So the blood comes out. You membrane, you run the blood over a membrane to oxygenate it, and then there's a setting called the sweep. And again, I'm not an ECMO expert, so please, everybody, help us with explaining all these nice things. So then there's a thing called the sweep, which is how long the blood gets like swept on the membrane, and that's what's extracting the CO2. So you're oxygenating it, and you're doing oxygenation and ventilation, okay? So that, literally in a nutshell, is what ECMO is. You got these big old cannulas that you get cannulated with, either CT surgery or vascular normally does it for us at least, and then you are on ECMO, and then you have a perfusionist, the same person that runs the heart and lung machine when you're on bypass, because it's the same thing. There's a perfusionist, thank you to all our perfusionists, at the bedside, 24/7, monitoring the ECMO. Okay, so that was a commonly heard of or talked about thing during COVID times, because you had like 30-year-olds going on ECMO, right? Which is pretty intense, because that's it. There's nothing more at that point. Lung transplant,